Well, I think it's about 2:30 and we're going to start our presentation. My name is Dr. Christopher Brodkin. I trained over at the wonderful Cook County Hospital, now in the John H. Stroger Jr. Hospital of Cook County. That's a mouthful. And I am now in Glenview, and I'm a ENH affiliated physician, and I'm an internal medicine specialist. And today I've been asked to come here and talk about osteoarthritis and the therapy for that. So let's start off. What is osteoarthritis? Does anyone know what osteoarthritis is? Okay. Well, osteoarthritis is a disease that causes cartilage to break down in joints. And as you can see here, we have a picture of the knee. You know, doesn't look like the knee from the outside. We've taken off the skin and the muscles. But we can see that there are areas of exposed bone. The cartilage is this white material right here, and it's eroding down, as we can see. And we also see some bony spurs coming out. When bone rubs up against bone, it forms little projections of bone, and those bones, when they rub against each other, equates to pain. Ouch. This is also called degenerative arthritis. There's different types of arthritis out there, but this is the most common form of arthritis. So we need to go through some definitions. Definition number one, what is cartilage? I've talked about it a little bit before. It's a smooth cushioning material inside the joints. If we were able to walk across the room and not have that cartilage to keep the smoothness there, we would have bone rubbing on bone, and we would always be in pain. But the way we were put together, we have this nice soft material to cause cushioning. Osteo, when we talk about osteoarthritis, means bone from the Latin. Arthritis means joint inflammation. So osteoarthritis means joint inflammation. What happens with osteoarthritis? The cartilage becomes rough and irregular, more bone gets exposed, bone rubbing on bone, more pain. Small pieces of bone and cartilage break off, meaning more bony growth can come out, more bone rubbing on bone. Basically, rough and irregular cartilage means pain with movement. But how does osteoarthritis really occur? You know, we can, understand what's going on in the knee, but through our daily lives and when we're growing up and as we age, how does it actually occur? Well, one thing is trauma. Trauma can cause this. And so we have a young lady skiing here, and she's going down the ski hill, and I don't know, anyone here ski ever? Okay, we got one skier in the audience, and two skiers, sorry about that. And when you go down these ski hills, sometimes they have rocks, sometimes they're a little bit bumpy, and it causes the high impact on the knees and a little bit of trauma. If she slid off the hill into a tree and banged her knee into a tree, that's trauma. What else can cause osteoarthritis? Well, if this lady fell too far backward, it might cause the ligament inside of her knee to tear. And sometimes there's these, not sometimes, but there are these large cartilage discs inside the knee that help, the cushioning of the knee, but they can tear as well with repeated trauma or a severe traumatic event. Being overweight or being obese can also lead to this, especially when I talk about the knees. These are the weight-bearing joints of your body. We have something here on Earth called gravity. And so if you have excess weight on your body, then you can put excess weight on these weight-bearing joints. And that can lead to wear and tear of the joints. And just general wear and tear with age leads to the cartilage breaking down, which can cause osteoarthritis. So you may be the skinniest man in the entire world or skinniest woman in the entire world, and you can still have breakdown of your joints if you use them throughout your life. What are the symptoms of osteoarthritis? Does anyone know what it's like to have osteoarthritis here? We got several people that know what it's like. What kind of symptoms do you have? Pain, ouch, oh, mild to severe pain in the joint after overuse or long periods of inactivity. So you've been sleeping overnight You try to move that leg, ow, pain in the hip. Stiffness, definitely. You ever hear a creaking or a grating sound, especially with your knee or your hip? Ooh.
Try it in your neck.
That's not good. You know that you also can get weakness in the muscles around the sore joint? Because when things hurt, you don't want to move them. Is that right? So if you don't move your joints, what can happen? You get a weaker joint, you have more bone pushing against bone, more cartilage breaking down. It's a vicious cycle of osteoarthritis. And then getting back to what you said, young lady, morning stiffness. But morning stiffness and osteoarthritis is different than all the other arthritis. There's other arthritis like rheumatoid, gout, but most of those arthritises will last, the morning stiffness will last for greater than a half hour. Most osteoarthritis, the stiffness lasts less than 30 minutes. Here I have a diagram. It is a diagram showing the vicious cycle of osteoarthritis. I've mentioned this already, where we see joint bones starting to collide together, and the knee is a perfect example. We start seeing them collide together. We hear the crunching noise when the joint is moved. That's a grating sound. Overgrowth of bone called arthritis, those little bony spurs that rub up against each other. More strain on the ligaments because you're trying to fight against that pain, and the ligaments are getting weaker. And as we see, ligaments are getting weaker. And then there's excessive joint movement because those ligaments should be tight in keeping that joint in line. But however, as the ligaments get weaker, they start sliding around, and the bones can start colliding more, and then we go back to the vicious cycle. How do we cure the vicious cycle? Well, somewhere along the way, we're going to have to break a spoke in the wheel. How do we diagnose osteoarthritis? One thing we can do that is very helpful to physicians is just taking a history and doing a physical examination. Most of our diagnoses, come just from asking questions. Most important question that we have is that 30 minutes or less of morning stiffness. That clues us in that it's really osteoarthritis. And then physical examination, we would examine the joint in question and see if it's consistent with osteoarthritis. What other things can we do to try to diagnose it? We can take an x-ray. So x-rays will show whether bone's on bone, whether there's bony overgrowth. We can also do blood tests to rule out other causes of joint inflammation. Is this really osteoarthritis, or could it be gout? Could it be rheumatoid arthritis? There's plenty of blood tests that we can do to make sure that we're treating your joint arthritis properly. We want to make sure we have the arthritis in the proper category. Is it osteoarthritis? Is it rheumatoid arthritis? Is it gouty arthritis? We want to make sure. Now, going on to the medical treatment of osteoarthritis, what kind of treatments do we have here? Well, let's talk about the aim of treatment. We have a degenerative joint disease. Well, we want to make sure the joint keeps working by reducing the strain on them, relieving the pain, the stiffness, and the swelling. Can you get swelling from osteoarthritis? Absolutely. Bone grinding on bone causes inflammation, and you can have fluid fill in that area. Looks just like rheumatoid arthritis or gout. Tylenol is a great medication that people can use. A lot of doctors will prescribe Tylenol, and sometimes we'll even make sure that you're getting constant doses around the clock. People with osteoarthritis have been known to take Tylenol every 4 to 6 hours, and it does cause pain relief. Another medication is a class called non-steroidal anti-inflammatories, or we doctors shorten it for NSAIDs. And such medications are ibuprofen, Aleve, naproxen. There's also another class called COX-2 inhibitors. We've probably heard about Celebrex. Anyone hear about Celebrex before? Okay. There was a wonderful COX-2 inhibitor called Vioxx, and it worked very well, but unfortunately, it had some mortality data with cardiovascular disease, so they pulled it from the market. Also, weight loss. If you're overweight and it's causing osteoarthritis of your weight-bearing joints, your knees, your ankles, your hips, weight loss will cause relief of the osteoarthritic pain. Water aerobics by going into a swimming pool, it actually displaces the gravity. What do we talk about with being overweight and being obese? Gravity is being a major factor because you have the excess weight on you. You're fighting against the force of gravity. And then if you go in the water, it displaces gravity, so you're able to exercise. If you're able to exercise, you're able to lose weight. Not only do you lose weight, but if you lose the weight, you have less weight going against those weight-bearing joints. Hot and cold therapies. What about warm water? Warm water is great. How about cold water that's frozen? Some people do use cold packs twice daily, 3 times daily. Also, there's something called capsaicin. What they found out is that people were eating these hot chili peppers. The hot chili peppers have oils in them. People who had osteoarthritis of their hands, when they were deveining the peppers, they were getting the oils under their fingernails, and somehow it started relieving the pain. So they started putting this into a cream, the oil called capsaicin, and people will rub the cream on their affected joints, and it causes the capsaicin chemical actually numbs the free nerve endings and decreases the arthritic pain. Another therapy for osteoarthritis is physical therapy. We talked about that vicious cycle that we had earlier. And the vicious cycle, we needed to break a spoke in the wheel. And one thing we can do is we can actually try to strengthen the affected joint. I like to talk about the knee because I have a therapy for the knee that I'm going to talk about later that helps quite a bit. And if you can strengthen the joint around the knee, then you have better joint stability. There will be less bone grinding on bone, and people start having some relief from their osteoarthritic pain. Now, has anyone heard about glucosamine and chondroitin? Glucosamine and chondroitin doesn't work for everybody, but for the moderate to severe pain was helpful in some individuals. You know, just like any kind of medication, let's say stomach medicine like Nexium. Nexium can only have like a 40% efficacy rate. So glucosamine chondroitin, if it only has a 25 or 30% efficacy rate, does it mean it works for everybody? That's 70% of the people don't get the benefit. But if 30% of the people get some benefit, it's better than nothing at all. And so that's why people say glucosamine chondroitin, and it doesn't interact with a lot of medications. So that's why it's a nice medication to use. Steroid injection therapy. So you've tried your Tylenol, you've tried your non-steroidals like ibuprofen, Aleve, COX-2 inhibitors like Vioxx and Celebrex. It's just not working. Well, there are steroid injections. You go to your physician and they can give them to you. And it does decrease pain. It can cause pain relief 1 to 2 months and decrease the inflammation in that knee. Remember, I talked about the knee grinding on the bones, grinding against the bones, and can cause inflammation. This will decrease the inflammation. However, there are some disadvantages. A lot of patients that get the injection, in the first 24 to 48 hours, they might get what's called a steroid flare, which is actually, you know, if you get the injection in your knee, you'll have a more red, painful knee than you had before the injection. But it should go away in 48 hours. We usually give Tylenol and ask you to put on ice packs frequently. One of the big problems with steroid therapy is that if you inject it into a tendon that's weak, there's also the possibility of a tendon rupture. And then the tendon is